So what we do here is we place 4 implants in this jaw, and this is a model. It basically shows you your jaw here, and where these implants are sitting are actually the bone. So these are going to go into the bone, and then the abutments sit on top of the tissue. And the bone actually doesn't have any nerve endings in it, so you're not going to feel pain in the bone. It's the tissue area that often sometimes can cause discomfort, but we're always going to take care of that for you. Now you'll heal all up and you'll have these abutments that sit on top of your tissue. So when you take this handy little denture and you put it back on top of here, if you've been wearing a denture before, it just rests on the tissue and it's moving around, it creates sores, doesn't always fit, so it often is doing this. Well, now we've put divots inside of this denture, and this is our patented denture that we use. So we put the divots inside with couplings, and they're going to fit right on top like this, and you're going to engage them. So now there's no movement, which is phenomenal. So when you're wearing a full upper denture, it's not moving, it's stable, and that's how it works. It's pretty incredible.